Welcome, everyone, to today's Public Health Essentials for Health Departments session, focused on local control, preemption, and public health authority. I'm Christine Ganella, Executive Director of the Pennsylvania Public Health Association and Managing Director of Strategy Development with Public Health Management Corporation. Today's webinar is being hosted by the Pennsylvania Public Health Association and Public Health Management Corporation, with support from the Centers for Disease Control and Prevention Public Health Infrastructure Grant and the National Association of County and City Health Officials. The Pennsylvania Public Health Association is a state association of the American Public Health Association and seeks to advance health in all policies throughout the Commonwealth of Pennsylvania. Public Health Management Corporation represents the Public Health Institute of both Pennsylvania and Delaware and seeks to build healthier communities through partnerships with government, foundations, businesses, and community-based organizations. PHMC fulfills its mission to improve the health of the community by providing outreach, health promotion, education, research, planning, technical assistance, and direct services. Today's webinar is being recorded and will be available in the next day or two on Train PA's learning management system. Additionally, a link to the recording will be sent to all registrants. All participants will be muted throughout the presentation. We encourage our participants to submit questions during the presentation. To do so, please use the Q&A tab on your Zoom control panel, and it will be relayed to the presenters and answered at the end of the webinar. Use the chat feature to introduce yourself and share any tech issues. To enable captions, please click on the closed caption button along the bottom of your Zoom window. You will see the option to enable live transcripts. A post-webinar survey will pop up at the end of the webinar. Please take a few minutes to complete the survey evaluating this live webinar, as your feedback is critical to the ongoing development of our webinar topics. Now, without further ado, I'd like to turn the presentation over to Sean McCormick.
Thank you, Christine. Let me share my screen. Okay, and please speak up if that doesn't look right, but I think we're good to go. Yeah, good afternoon. It is noon now here. Hope everybody's having a great day. Thank you to the Pennsylvania Public Health Association for inviting us to present on preemption and public health authority. My name is Sean McCormick. I use the he, him pronouns. I'm the Director of Public Health Programs at Latino Connection Foundation. We typically go by LCF. We are a relatively new nonprofit spin-off of the for-profit Latino Connection, but the foundation can do some things, obviously, that for-profits cannot do. But as you can see, our mission there is related to strengthening communities and nurturing the development of leadership. Just a bit more background about myself and our pillars. So I'm a public health professional. I have a lot of experience in the fields of prevention, health behavior change, program design, evaluation, and policy. And so this presentation here brings together a little bit of all of that. But LCF has three main pillars. We have public health and community education programs, such as this policy education work. We also have a program to advance and promote early childhood development and positive parenting called The Basics. One pillar that's still being stood up is our workforce development. And then we have some properties and some actual physical buildings where we provide affordable housing, Sycamore Homes and Woodward Lofts. And here's just a picture of the Sycamore Homes. It's a rendition, but the building is up. So we are trying to walk the walk, not just talk the talk when it comes to social determinants of health, public health, and in this case, housing. So a little bit about what brings us here and the funding behind this presentation, this programming. The main source of funding is the Voices for Healthy Kids program from the American Heart Association. We're very grateful to our partners there, as well as our co-grantees, Pennsylvania's Clean Air Council. There's some folks from CAC on right now. Thanks to them for their work in environmental policy and environmental justice advocacy. It's great to have some legal professionals in the mix here, because a lot of what we're going to talk about is public health policy, but it also pertains to law. But yeah, the target audience for this Voices for Healthy Kids grant is really everybody. We are focusing in large part on reaching professionals in healthcare and social services so that folks in the field can understand how preemption and other public health related policies impact health and social determinants of health. And there's also a lot of room to educate the general public about what preemption is and how local authority impacts health and decisions made by those in elected positions can impact our day-to-day well-being and health. So the goal for this program is to understand preemption and understand how preemption can affect public health authority. Like we're doing today, we're aiming to build capacity for organizations and individuals to have conversations about preemption. In all honesty, I didn't know what preemption was 2 or 3 years ago, and there is a lot of what we do in terms of many different types of public health and social determinants of health issues that are affected by preemption and similar authority level policies. And so we'll talk a little bit more about that. But if people have a greater understanding about policies and legal concepts like preemption, it puts us and them in a better position to advance policy that promotes health. And then the lens that a lot of this work is happening through is through tobacco and clean indoor air laws. And so we'll talk about how those two are related. And that's really where the Voices for Healthy Kids mission line aligns with this work, and that clean indoor air is really important for healthy kids. So yeah, we do presentations and webinars like this. We go out in the community and have lunch and learns, and then we create communication materials like infographics and one-pagers, and we have stuff on our website. So what is preemption? Basically, it's a legal concept where higher levels of government limit or prevent a lower level of government from passing a law on a specific issue. So the higher level of government might be the federal level or the state level. And it could prohibit or stop a city or a county, for example, from passing their own policy that might differ from the state or the federal level policy. So unfortunately, a lot of what happens is local authorities and municipalities and local communities would like to advance public health and pass policy that's going to help protect their health and increase their chances of having a healthy and thriving community, but they are preempted. So we'll explore some of the other examples, but in general, and I think this is relevant to this audience here, there is a trend where local public health and local authority is being chipped away, with decision-making power and authority being relegated back up to state levels and maybe into offices that are held by folks that are not public health professionals. Preemption is just one tactic, one example. So in a way, this conversation is about preemption, and it is also about understanding policy and civic engagement and how laws and policies impact health and well-being, and that preemption is a fairly easy to understand topic, and it's a way to get people engaged. Same with clean indoor air, that trying to engage somebody in a conversation about law and policy can sometimes be difficult, but when you have an example like clean indoor air, that hits home for people and people can kind of latch onto that. So we'll talk a little bit more about that as we go. So I'm sorry if there's some folks that know a lot about this, but for those that don't, there are different types of preemption. There's floor preemption, where a minimum threshold must be met. An example of that would be minimum wage. There's a minimum to the wage rate that employers can pay. For public health advocates, this could be desirable, to establish that minimum, but then it's allowable to have something go above that limit. Ceiling, the opposite. Ceiling preemption refers to a maximum limit that cannot be exceeded. So, for example, rent control, can't have rent go super high. Clean stream laws, there's like a ceiling to the amount of allowable pollution from farms or industries in terms of the amount of pollution or the amount of pesticides that they're able to release. Vacuum preemption is another type of preemption where if there is no law or no policy, then a state or a locality that has vacuum preemption is not allowed to create their own law, even if there is not a law. So, for example, Wisconsin does not allow local municipalities to enact a paid leave law, but Wisconsin does not have its own paid leave policy. So, right, you could see there where a county or a city in Wisconsin might like to pass their own paid leave law to improve the well-being and health of their population, but they are preempted by the state from doing so. Couple more. Punitive preemption is basically, it could be any of these other types of preemption, but basically a local authority can be punished if they try to pass their own law in a space that is preempted. An example of that punishment might be withholding of shared revenue. So for states or for cities and counties that are trying to balance a budget, the threat of withholding revenue is actually a pretty severe punishment. One more bit to know here, there's degrees of preemption, could be narrow or wide, so it affects a whole span of, for example, types of pollution, or very narrow where a law is on the books for a very specific type of pollutant or chemical, for example. So here's just some boxes that show some of the other topics that have experienced or have been impacted by preemption. Labor and wages, single-use plastics or plastic bag bans, environmental justice, like we talked about, tobacco and vaping. A lot of policies that you might like to pass around tobacco or vaping are preempted. Gun safety, rent control and housing, the way that revenue sources are designated and managed is also often preempted, and many, many more issues. We will be talking a little bit more about the Preemption Coalition in Pennsylvania at the end, but we are open to hearing from other folks if you in your space, in your sector, whatever that may be, have experienced some form of barrier to your work due to policy restrictions like preemption. Another example would be like early childhood education and childcare. Okay, so just a couple more examples or specific examples. In Texas, local municipalities are prohibited or preempted from establishing diversity, equity, inclusion offices. Preemption in Texas makes it more difficult for cities to convert property into housing. There are restrictions in Texas and probably other states too, where it makes it difficult to turn street lanes, traffic lanes into bike lanes or bus lanes or sidewalks, all things that make a city healthier and safer and happier. Preemption limits the local authority to do so. And if anybody would like these slides later, I can certainly share them, and there's articles embedded, so sometimes it's nice to have the slides so that you can click on the link and get to the article. Just one example, there is some preemption that can be, acceptable. One example is in Florida, there were local homeowners associations that were trying to ban the homeowners from having vegetable and food gardens on their property, and the state disallowed those local homeowners associations from prohibiting that. Having a garden or having like a little food farm in your own property. So it's about when does preemption become abusive, and typically, or one of the litmus tests is basically is industry power outweighing local power. Local officials know their communities and want to serve their communities, and if industry backed interests come in and basically outweigh the local authority and put legal pressure to maintain the status quo or to enact preemption, that limits the local officials and local communities from being able to design and manage their resources in their communities the way that they see fit. So it's pretty difficult to quantify this stuff, but there have been some studies and some articles that have looked at that. This example here, people in Mississippi die on average up to 5.5 years sooner than people in New York, where state lawmakers don't put restrictions on what types of public health policies cities can implement. So there's lots of preemption in Mississippi, not as much in New York. Another example is related to paid sick and maternal leave. That's minimum wage, paid sick, and maternal leave, right? Those things actually have an impact on people's day-to-day life and the extent to which they can go out and get a good paying job, get health insurance, that sort of thing. And so for people that aren't protected by a minimum wage, a sufficient minimum wage, or paid sick law, or maternal leave law, they're at risk of having their health and well-being put into jeopardy. Any questions so far? And I know I've got some wonderful teammates on here. Does anybody from Clean Air Council or anybody else from LCF like to chime in?
Hey everyone, Logan Weldy from Clean Air Council. Doing a great job, Sean.
No notes. No. Okay, great.
No notes.
We'll
Doing
keep
a
it
great
rolling.
job.
All right. Well, the chat is open. I believe people can use the Q&A or the chat. So feel free to, and moderators, please, if I can't see the chat, so if someone does put a question in the chat, please interrupt me. So that was a quick and dirty overview of preemption with some examples. I think relevant to this group would be just a few other examples of how public health authority has been changing, limited. I did mention that there is a lot of authority and decision-making power moving from local health departments up to state legislature. The scary part there is that power is being taken from medical and public health experts and infectious disease experts and the like to non-experts and legislators. Not that legislators might not have, staff and resources to look into issues and to make informed decisions, but the folks at the local level know their communities best and they are professionals in those fields. And, we'd like to have decisions made, at the local level whenever possible. There's just a example there of some of the language that's used. So if you look at the bottom, this statute streamlines and clarifies existing regulations by transferring decision-making authority from the Department of Health and Welfare back to Idaho legislature. So that's just in Idaho, but this is happening all over the place. So a lot of this was already happening before COVID and the pandemic, but this pandemic spurred this sort of movement and restriction of the local public health authority. When there's uncertainty, a lot of times the local authority is then overridden by state and county level. So there may have been, local needs to enforce mask mandates and vaccines, and the states were often overriding the local public health authority to do so. Here's just an example: 26 states push through laws permanently weakening government authority to protect public health and local public health authority. The immigration and border crisis, not directly related to health, but certainly a social justice and social determinants of health related issue. Many preemptive bills have been passed in 25 states. Basically, if you go back just like a year or two, there were just a few immigration preemption bills, and now there are 71 immigration-related preemption bills. One example there is the states can be sued if states and cities can be sued if they adopt a sanctuary policy. And then we mentioned the punitive preemption. So there's the threat of federal funding being withheld if states and cities pass some of these immigration-friendly policies. Just another twist to this, or another example that we came across along with through our work here, is this reducing the availability of data tactic. I'm not sure how much this is happening, but there is at least this one example where, public health needs data to inform its work and to justify its work. And one example would be the Pennsylvania youth survey and some of the risky behavior surveys, where we can get a sense of how widespread are behaviors like drug use, sexual activity, unprotected sex and dangerous sexual activity, gun violence, that sort of thing. And the data comes from, right, with the youth survey, comes directly from the youth. And in the past, these surveys were opt out. So every student was automatically going to be providing data into the survey, and the parent had then the opportunity to opt out. And so what that meant was we really got a lot of data, robust data sets to make clear, informed decisions based on geography, based on topic, needs, specific health issue. And there were changes in Pennsylvania and other states where some of these surveys were then defaulted to and changed to opt in. And so then a parent had to, or a caregiver had to opt their child into the survey. And when that happened, the amount of data just dropped drastically. And so then when public health program officials and program designers and evaluators do not have adequate data, it's difficult to make the case for funding for those programs, to evaluate the impact of those programs. So it's just another example of the way that public health authority has been chipped away at. All right, so let's pivot a little bit into the specific topic of tobacco control and clean indoor air. So, right, if we could wave a magic wand in public health, we'd probably just ban all tobacco products or make some major changes like increase the age of purchase or reduce nicotine content. But a lot of these things can't be done. We're preempted at the federal level and state level to change age of purchase, to change nicotine content. Right, the menthol ban has been a topic that it was proposed, I believe, in the Biden administration, and I think they thought it was politically dangerous to pass a menthol ban, and so they backed away from it. And then the Trump administration has completely jettisoned that. So that's not going to be happening at a national level. And trying to pass that locally probably has its own chances, or its own challenges, rather, excuse me. Changing the prices or raising taxes is often preempted. And then clean indoor air laws. We're going to talk a little bit more about that. But it would be nice for public health if cities and counties could create their own clean indoor air laws, but in a state like Pennsylvania, they are preempted from having clean indoor laws that differ from the state level law. So if you're not familiar with Pennsylvania's Clean Indoor Air Act, it makes all public places and indoor workplaces smoke-free. There are some exemptions. Bars that sell mostly alcohol and do not have food sales, private clubs, and casinos can allow smoking. So, right, patrons and probably more important, employees are exposed to potentially really high amounts of secondhand and thirdhand smoke. So there is a bill that has made its way through and maybe out of committee. It seems like it has a good chance of passing to close the loopholes with the casinos and make some other changes to the Clean Indoor Air Act. We'll talk a little bit more about that in a second. But the main thing to know here is that the elimination of the exemptions is being fought by casino owners and some labor unions. Just real briefly, right? You know, it seems like, oh, is this really an issue? Is there that much exposure? But there really is a lot of secondhand smoke in casinos. We can kind of skip over that slide. Dealers that work in casinos, especially at table games, are exposed to really high levels of secondhand smoke and have measured elevated levels of nicotine and carcinogens. There was a story we heard, I don't remember which casino it was, but they had a policy or a workplace practice where the dealers at the table games would rotate in and out of the smoking section every 20 minutes to give people a break so that they, I mean, you know, in a way, shame on them for allowing smoking, but good on them that they realized that only 15 or 20 minutes, you know, people needed to get rotated out of that smoking section, which, you know, you're sitting, I don't go to a casino very often, but you're sitting 2 feet from the dealer. So someone who's smoking, they're sharing the cigarette practically with the person who's working the table. So this leads to a lot of secondhand smoke. That second bullet there, smoke-filled casinos have up to 50 times more cancer-causing particles in the air than city streets during rush hour. The last bullet there, patrons were also found to have significantly elevated levels of tobacco-specific lung carcinogens after a 4-hour visit to a casino that allowed smoking. Pretty nasty, right? And then these casino workers, one, they love a lot of these folks really like their job. There's, oh, they just go get another job, but, there should also be some merit or some like weight laid into the idea that people should be able to pursue the type of employment that they want to pursue. A lot of these folks have a life situation where they might need a second job and might need second or third shift jobs. The casinos can provide that type of employment opportunity. And there might just not be as many good paying jobs available. And so people may see working at the casino as a really good option for them. Yet it comes with this risk of exposure, or not risk, but guarantee of exposure to second and third hand smoke, right? And so casino workers themselves could be pregnant and or taking third hand smoke home. If you're not familiar, third hand smoke is when the chemicals and particulate matter from cigarette smoke get into bags and clothes and hair and skin, and then the chemicals can be caused to re-enter the air when you rub up against somebody, or a kid gives somebody a hug who's wearing a sweater or a jacket that they wore in that environment. So it's not they're breathing it out of the air, but it's coming off of being emitted off of the fabric or something that was exposed to smoke. So here's the bill that is up. It's not the bill from this year, but it's, again, Representative Frankel, and it's doing the same thing, basically trying to close these casino loopholes. One of the questions that always comes up is, what about the casino bottom lines? And really, the evidence that has been gathered shows that the casinos do fine. They do well, if not better. Parks Casino has been smoke-free for a while, and they have not been negatively impacted. There's some evidence that actually casino revenues go up. And there was a sort of natural experiment when we had COVID, because the casinos did go smoke-free during COVID, and the bottom lines didn't really change then. So it's a little bit interesting to try to understand where the casinos are coming from on this front, where if they could be protecting their employees and their patrons and their bottom lines aren't affected. If anything, they could be improved. Why are they holding back? But it's good for business. Okay. So just a couple thoughts and ideas about, what do we do about preemption? And one of the things we can do is what we're doing here, which is just educate everybody about what it is and how it impacts different policies and public health activities. There does need to be some organizing and some advocacy around different types of legislation, as we mentioned in this Clean Indoor Air Bill. There is the possibility of focusing on if a bill can't be stopped, or a bill isn't going to go through, that making compromises and amendments is an option. But this is like a long haul. A lot of this work is long haul. That the closing the loopholes in the Clean Indoor Air, well, that's been in the works for years, probably since the first Clean Indoor Air Act was passed in Pennsylvania, with these exemptions, which nobody was known in the public health sphere was happy about. But it was good to get most of the workplaces protected, and then you're spending the next 10, 15, 20 years trying to close the exemptions or close the loopholes. Ballot initiatives, letting people vote, can be a way to combat abusive preemption. Going to court. Not every municipality or county has the legal appetite or the financial resources to litigate, but sometimes that's what it takes. And that's where it's nice to have some folks like the attorneys on staff at Clean Air Council to help weigh in on this. And I know Clean Air Council has gone to court many times in service of public health. So thank you all for doing that. Another group, the city attorneys and district attorneys and state attorneys general, are also folks that can be a partner on this front as well. And then it's tricky, right? Like, this has been a relatively, I would say, dry conversation. What is preemption? People don't know what it is and how it affects their life, and trying to connect dots 2, 3, and 4 to how your life is actually impacted. And maybe we could be doing a better job having vignettes with individual and personalized stories and lived experience. But So that's part of what this work involves too, is changing the communication and messaging about public health policy. Another piece that we've been working on in terms of the tobacco and vaping space, prevention and control space, is through zoning, right? So we cannot ban vape and tobacco retailers in any part of Pennsylvania, but local municipalities do have pretty broad powers to zone how those retailers and merchants exist within their districts and in their municipalities. So one example is Darby Borough, which is here. I'm in Delaware County. Darby's in Delaware County. They couldn't just close all the vape shops and all the tobacco shops, but what they did was they zoned for them differently. So what that looked like was changing the allowable density. So in terms of the geographic space and population, they lowered the amount of tobacco and vape retailers that were allowed within that population geographic space. They then also limited the proximity to schools and other youth serving locations. And they broadened the definition of a tobacco or vape retailer, so that in the past it was something like 40% or more of the store's revenue had to be from tobacco in order for them to be categorized as a tobacco retailer. And then they lowered it to, don't quote me on this, but to say 20%. So even if a location is selling, it doesn't have a whole lot of their revenue coming from tobacco, they still are an outlet. And so now they're categorized as an outlet. That then changes the way those proximity ordinances and the density ordinances operate, right? When you've changed the amount of retailers in general, you've changed how soon or how likely you are to hit the density limits. And so we're trying to create we're in the process of creating a toolkit for local municipalities, mostly city level officials, to understand what authority do they have to zone around tobacco and vape retailers. And so now, while they cannot prohibit vape and tobacco stores in their communities, they can do quite a bit to zone for them. And to have all that in a 5 to 15 page document with example language and technical assistance and that sort of thing, I think would be pretty useful. Another piece here, let's see how we're doing on time. I think we're doing pretty good. Another example is home rule. So home rule is the idea, let's see, what's the next slide. Yeah, home rule, there we go, look at that. Nice big purple slide. What is home rule? So home rule is basically the opposite of preemption, where local governments can make their own choices about all sorts of structural and policy and health-related ordinances and laws. People in the community get to be heard. Local leaders have the power to decide what is best for their communities. And so because Pennsylvania has a lot of law and policy that is preempted, there have been a good number of counties and cities that have, no, it doesn't come up here. Sorry about that. 84 cities in PA have passed home rule that allows them to create their own laws and policies on a range of topics, and that's all dependent on what their home rule charter looks like. But Lancaster is a big city. They just recently passed a home rule charter. Norristown, Philly, Pittsburgh, and so there's 84 cities in PA that have home rule on various topics. And there's entire counties too. I think that was the other list. Sorry about that. So it's interesting. You see people sort of say, hey, we're not able to meet the demands of our communities, and our constituents are asking for things like paid leave and are asking for changes to housing policy and to bike lanes and that sort of thing. And they say, well, if home rule is one way for us to gain control back over those issues, let's pass a home rule charter. Certainly some responsibility and a lot of work comes with that, but that is all in the name of service of the constituents. So some other calls to action here pertaining to the clean indoor air laws. Like I said, there is some legislation moving, and if this is something that you are willing to speak up about, it's great to start to build a relationship. If you're not familiar with your elected officials and don't have a relationship with them as a public health professional, that's something that you might want to put on your to-do list. we're happy to connect with anybody who's looking to make legislative visits and learn how to effectively communicate with your legislators. They are people and they like to hear from us. So keeping track of the legislation, seeing, is it within the committee, are there co-sponsors signed up, is it out of, in the House, out of the House, up to the Senate, that sort of thing. And educating the public, which we're doing here. So, if you have another organization or even an individual that you think would like to learn about this, we are funded to do more presentations like this and have conversations like this. And so if there's an organization that would be interested in hearing more or being exposed to this type of work, please connect us. We have this Pennsylvania Cross-Topic Preemption Coalition. Some of the folks on the call here started this a number of years ago, and that's how I got roped into this. They kept saying, Sean, tobacco comes up in the Preemption Coalition all the time. You should come to this Preemption Coalition. We talk about tobacco almost every time. And I said, I don't know what that is. And so I joined up and learned that, there's a lot of public health and social determinants of health and social justice activities that are preempted. And so here we are, pushing the ball forward and educating the masses about preemption and what we can do about it. So there's a lot of great resources up on the coalition's Google page. And we do deep dives into specific bills and legislation and different topics. And so sometimes we'll get into plastic bag bans or childcare or tobacco or rent control or paid leave and all that sort of stuff. So it's a great group, and feel free to email me if you'd like to sign up for that. I think there might be a couple questions in the chat, but I am basically done, so we will open it up. Thank you very much to Christine, Hayden, everybody over at PPHA. Really appreciate this opportunity. Thanks to the team at Clean Air Council and my colleagues at LCF and everyone else that's been helping with this project. Here's my email address at the bottom there. Feel free to reach out. We'd love to talk more. Thank you. Just some resources at the end too. I'll stop sharing my slides.
Yeah, Sean, do you want to share those resources just while we're opening it up for some questions? Just really appreciate you going through just the background, the depth, kind of orienting us to public health preemption. I thought it was really interesting to go through the counties, the cities, on the home rule. So just thanks for just grounding us in that conversation and sharing all the really amazing work that the larger group has really done in Pennsylvania. I want to make sure that we have some time for questions. Feel free to pop the questions in the Q&A down on your the bottom part of your screen. It looks like Hayden shared here, or Sean shared in here in the chat, some of those resources that were shared on the slide deck. Some really good resources here, and we'll make sure that that gets captured and shared out to participants after this call.
Yeah, sorry, not all the links work there, but I think people can get a sense of what they need to go and Google search for. I would definitely recommend the Center for Public Health Law at Temple, the phlr.temple.edu. They are high-level professionals in this space and have put together some really great resources on this. And so, we're not the only ones that are pushing this along and raising awareness about this. And in fact, they are diving into some very intricate and heavy-hitting research about how these things actually impact health. So it's pretty inspiring work over there if you're interested in reading more.
Shout out to our local partners over at Temple for that great work.
Thank you.
So again, please feel free. I know Sean had shared his email. If you have any questions for Sean that come up after reviewing the resources, reach out to Sean, or you're welcome to reach out to us. We're happy to put you in touch with Sean. As we close out today, want to encourage you, if you're not a member of the Pennsylvania Public Health Association, to consider being a member. This is the QR code where you can access information on our membership, and certainly follow us on any of the social media platforms that we're on. or access our website. We do have a number of training opportunities, webinars. We do monthly webinars and periodically in-person gatherings as well. So please reach out to us if there are any questions. We'd love to have you join as a member. And if there are no questions for today, Sean, thanks for putting your contact information in the chat. If there are no questions for today, thank you again for joining us on today's webinar. A huge thank you to Sean. Great to see Logan there as well, representing Clean Air Council. And hope that everyone has a wonderful rest of